Thank you very much. I was given the job to talk about robotic cholecystectomy. I have no disclosures, unfortunately. I do have a disclaimer though. I am a maximally invasive, minimally invasive surgeon. I do HIPEX. I do a lot on the robot as well. I probably do 80% of my cholecystectomies open for oncologic surgeries, and the rest, I've done a handful of robotic surgeries for cholecystectomy. I know in all the other talks we've talked about robotic cholecystectomy. There are a couple of different port placements and where you can put the arms, and really depends on where you want the camera is the biggest. This is the most popular arrangement on the XI, with the 30-degree camera on the third arm, or you can have the 30-degree camera on the second arm. I think that one of the biggest benefits of robotic cholecystectomy is ICG Firefly, and I'm going to spend most of my talk on that. We've all heard the SAGE's Safe Cholecystectomy Program, and I'm just going to highlight on this talk these 2 points to understand and visualize potential for aberrant anatomy in all cases, and to make liberal use of cholangiography or other methods to identify the biliary tree. Understanding and visualizing the potential for aberrant anatomy in all cases is an important part. You can have either variations in your cystic duct or your hepatic ducts. And in a very difficult gallbladder, when you have fusion of these ducts, the critical view is essential. ICG Firefly can be a benefit in these circumstances. You do have to give it in advance. It's fairly inexpensive for a 25 milligram vial that gives you 5 doses. So it's about $16 per dose, and a few adverse reactions, which is mainly the anaphylactic reactions, rash, shortness of breath. This is just an image showing about 2 hours after injection on the console. You can see the cystic duct here. This was giving about 5 milligrams in pre-op, and with the goal of injection about 1 to 2 hours prior to when you need it. And you can actually see an accessory duct, a hepatic duct going behind here, and that's the benefit, is to identify this before you have a bile duct injury. So this study looks at could ICG-aided robotic cholecystectomy reduce the rate of open conversion in bile duct injuries. This study was in 2016, looked at robotic cholecystectomy, laparoscopic cholecystectomy, and this is only in patients that actually got the Firefly technology. You can see in this study, the rate of bile duct injury is actually lower with the use of Firefly. So the conclusions these authors had was routine implementation of ICG-aided cholangiography and the technical advantages with the robot platform may significantly decrease the rate of open. Other studies have questioned this as well. Of course, there's other benefits of robotic surgeries. Excuse me, physical ergonomics, the laparoscopic surgery can be uncomfortable if you don't have the monitor in the right place, or your arms aren't, and the table isn't at the right location, and you do have 3D imaging with the camera and improved visualization on the robot. This is just a cost analysis looking at laparoscopic versus robotic cholecystectomy in a single center, just overall cost for the hospital, not what actually gets paid out. When you look at this, and when you look at other presentations, you can think, well, there is no benefit to robotic cholecystectomy because there are typically higher costs at all cases. Excuse me, a cost comparison with looking at when laparoscopic cholecystectomy first came out compared to open versus when the robotic platform came out. And they found when they adjusted for the, according to the current US dollar, the added cost difference between each emerging technology would be about $270 per case. And this is another study looking at the conversion to open and the cost of conversion to open, and theoretically robotic surgery would decrease the cost of the conversion to open. The authors found that the risk-adjusted cost per patient for any kind of conversion from a minimally invasive platform was about $47,000. When you put this all together, if we could decrease the rate of conversion to open, decrease the risk of BDIs with Firefly, and theoretically decrease the length of stay, if you add all those together, you could potentially increase your margin, and there are benefits. And I put this last slide up looking at BDIs in general. The reality, 86% of BDI-related malpractice claims are resolved in favor of the patient. Most settlements are about $200,000 to $500,000. But the medical cost, in addition to that, is about $25,000 to $150,000. So if we can improve our surgeries with Firefly assisted robotic cholecystectomy and hopefully decrease our overall BDIs, even the additional cost per case, you're going to decrease your overall cost, medical legal cost in the long run. So I'd like to thank you.